Hey Amazen fam, welcome back to my channel. If you are joining me for the first time, my name is Kim Amazen. I make content based on running a small business, do it yourself, and lifestyle. So today my topic is protecting yourself as a CNA and doing your documentation. Guys, so we all know that documentation is very important. So we have to do our documents. It doesn't matter what happened, guys, we have to make sure we document everything that happened. Because at the end of the day, we have to protect ourselves, because remember, these stuff that we document can use back in court against us. We don't want to go to jail because of something that wasn't documented. So let's get into it, guys. Let's get into it. So listen, the first thing when you go on the job, make sure you get your report from the nurse. I don't care if it was with the patient yesterday or the day before, make sure you get the report from the nurse. Ask if there's anything new going on with the patient. So guys, so one day I got floated, right? I work part-time, so I get floated all over. So this day I might work on long term, next day, I'm in dementia care, next day I'm on rehab. So I work on rehab, and I went to the nurse and I asked, okay, can I get the report on these patients? And the nurse said to me, I'm just coming in, or it's long time I haven't worked down here, I don't know either. You think I was gonna touch the patient? Nope. You better go find out. You better go find out and let me know what's going on, because you're the nurse. I'm not gonna risk myself and risk my life. And nope, I have time, I'll wait. So guys, you make sure you go to the nurse, and make sure, I don't care if she said okay, she's just coming in and she don't know what's going on and stuff like that. You get everything, get a report from the nurse. Let you go find out. You have time. Wait, guys, do not touch that patient until you get the report from the nurse. If you know there's a new patient, you're not gonna assume that this person look like they can stand up, so let me go over there and stand them up. Because guys, if anything happens, remember, it's coming back to you. So make sure you get your report from the nurse. That's the first thing. Before you touch a patient, get the report from the nurse. Alright? So after you get your report, guys, the first thing you should do as a CNA, do your rounds. Do your rounds. Just make sure you look at your assignment, see who you're assigned to, and just walk around. Make sure, guys, that there's nobody trying to climb out the bed. No one is trying to stand up. No one is trying to reach for anything, because at the end of the day, guys, we do not want anything to fall back on us. So you're doing care, guys, and you notice, okay, for example, the patient have a Foley bag. You notice, okay, it's maybe 12 o'clock, there's no urine in the bag. Make sure you report it to the nurse. Anything you see, guys, report it to the nurse. You're doing a patient, you see a bruise, you don't know about the bruise, you don't know if the bruise is old. Even if the bruise look old, make sure you report it to the nurse, because you don't want nothing to come back on you. So you have to report everything that you see. If you have a patient and the patient complaining, report it to the nurse. Guys, remember, at the end of the day, you have to cover yourself. Nobody have time to go to jail. We're not trying to go to jail behind anything. So we have to report everything. Everything we see, we have to report it to the nurse. Alright, guys, so you're doing the documents, guys. You're going to document any change in the skin. If you see the skin look red, the skin look dry, if the skin have a bruise, if you have a cut, anything you see, guys, document it and make sure you report it to the nurse, because at the end of the day, you have to cover yourself. You don't want nothing to look like, okay, you're abusing the patient or anything. So at the end of the day, guys, you just have to cover yourself. When you walk onto the job, just remember, nobody's your friend. There's not like nobody gonna cover for you and be like, oh no, she didn't do it. I mean, some people probably cover for you, but listen, if they're seeing stuff on the patient and you know you didn't do it, just report anything you see. Anything you see, if it's an old bruise, report it. I rather report it than assume that, okay, maybe they had a shift before, reported it. No, I'm gonna report it again just to cover myself, because at the end of the day, I do not want to let anything come back to me. So I don't care if the bruise was there a week ago and it's my first time seeing it. And guys, I'm talking as a part-time worker. So if I'm not with a patient every day and I'm seeing this bruise for the first time, I rather to report the bruise and let the nurse know. Let the nurse tell me out of her own mouth that, oh, it's been reported already. I rather she tell me that, but I'm not gonna assume that okay, maybe they know about this, because at the end of the day, guys, I do not want nothing to fall back on me. And some of these jobs, they wait until 2 and 3 weeks time. When you forget about everything, then you're gonna get a phone call. Oh, you know, there was a bruise and such, or there was a redness. You know, you just want to report everything, guys, just to cover yourself. Report it. Guys, when you do your documents, document like your life depends on it. So the other day I was at work and it was 3 o'clock, and you know it's time for me to go, but I still have 2 patients that I need to do documentation on. So in my head I was like, you know what, I'm working tomorrow, which is Friday, so I can just do my documentation, you know, when I come in, like try to come in early in the morning and then do it. But at the end of the day, guys, if I go home and anything happen or they see anything, then I don't want them to go back into the computer and notice that I didn't do my documents. So guess what? The computer was really slow. By the time I finished, it was like 4 o'clock. But I'd rather to do that and leave late than come home and then something will happen and then they fall back on me. At the end of the day, I have to protect myself. I have my children I have to come home to, so I have to protect myself, guys. You have to document like your life depends on it. You see a redness, the patient foot looks swell, document it. You make your nurse know, listen, I was doing such and such and I noticed that their foot is swollen. I'm just letting you know. Make sure you're telling nurse everything. When I business, if the nurse wants to say, oh my God, everything you come to me, make them say that. At the end of the day, you protect your license. Because guess what? If you lose your license behind this silly stuff, you have to protect yourself and protect everything. Guys, so if you're working and you see a sign, say stop. See nurse.
I say, hold up, wait a minute, something ain't right.
Make sure you stop and go check the nurse and see what's going on with the patient. I know at the side, sometimes they have the gloves and the mask and the gown, and you just want to go put it on. Nah, go find out what's wrong with the patient. Now just go in there, so. No, I want to know. Is something wrong with the urine? Is something with the cut? Is something? No. You need to stop and go see the nurse. We're not risk ourselves. We're not risking our life, guys. We are protect ourselves. You understand? Guys, I hope you understand. So you have to stop and see the nurse and find out what is going on with the patient. Do not assume and just put on your gloves and put on your mask and you know you're going and you're gone into the patient room. No, stop and see the nurse before you enter the room. I want to know what's going on in this room. Remember, at the end of the day, you're going to walk, after you finish work, you have to walk against your co-worker. You probably have to go to the supermarket. You go home to your family. You don't want to walk with no. Stop. Check out the nurse to walk on with the patient. Alright? I hope you guys understand that because I was just speaking in past, so I hope you guys understand that, okay? Alright guys, so any machine you're using, the higher lift, the course lift, sit to stand, guys, I don't know what you call it at your facility. But listen, before you touch the machine there, you make sure you get somebody to come in and help you. Do not do the patient with the machine by itself because guys, if the patient drop or broke them foot or broke them hand or get a bump or a scratch and them say, guess what? Oh, she was only doing the machine by herself. You know what's gonna happen? You end up lose your job and you can lose your license behind that. And I know sometimes we're looking for help and we can't find anyone and you know we're like, okay, we can do it, it's just a quick, you know, let's just go in there. Guys, but if anything should happen to the patient, that's your license. So protect yourself, protect your license. So guys, do not, I don't care how long you have to wait. I don't have what a word. I don't care how long you have to wait, guys. Get a nurse, get a manager, and get a CNA. Ask them to give you an eye. Do not touch that machine by yourself because they think say the job is going to start. Okay, let me speak in English. You think the job is going to be sorry for you and be like, okay, you know, she's a good aide. No, because the care plan is saying that 2 persons should use the machine. And now you go use the machine by yourself and something happen and you expect, oh, your job is going to feel sorry for you. Nope. They fire you and replace your boo. So make sure you follow the care plan and make sure you use 2 persons. Protect yourself, protect your license. if you have a patient, listen, check the menu before you serve them the food. You don't want somebody that's having a puree and you go give them hard food, or whatever, or you give them solid food. You have to check the menu, guys, because guess what? If anybody choke and they check the menu and then they'll be like, oh, who passed the tray? Who was feeding them? Who you think it's gonna come back to? Check the menu, make sure, because guys, we're all human. Sometimes we're dependent on the kitchen because the kitchen is the one that's serving the food, and we are dependent on the kitchen to do their job. But still, we have to check behind them because we have to make sure that whatever they're serving, that's what's on the menu. Like at the end of the day, we have to protect ourselves because guess what? The kitchen serve it, but if I'm the one who passed the tray and go give it to a patient and something happened, guess who it's gonna come back to? Me, of course. So at the end of the day, I have to protect myself and I have to document everything that I did for the patient, guys. So make sure, guys, when you're working, protect yourself, do your documentation. If the patient is diabetic and you give them their lunch or their breakfast or their dinner, you make sure you check it to make sure you have the right juice. You don't want to go give them no regular juice that's full of sugar. If the patient is diabetic, you don't want to go give them no regular sugar. You want to check and make sure that they're getting the that pink sugar. I forgot the pink sugar name, but it's not some diabetic sugar, but that they have for people that's diabetic, guys. If you know that you have a patient that's not supposed to have salt on the tray and you see the salt, guys, check with the nurse, take it off. At the end of the day, guys, protect yourself, protect your license, do your documentation. Thank you, guys, for listening to me talking about protecting yourself as a CNA and doing your documentation, guys. Please leave a comment in the comment section, guys. Let's have a discussion, guys, and tell me ways in which you can protect yourself and protect your license, guys. At the end of the day, guys, we all want to go home. We are too beautiful to go to jail, so we have to protect ourselves and do our documentation. Guys, I want to thank you guys for tuning in and thank you for being a part of the family. Guys, if you are new, welcome to the family. Don't be a stranger. Leave a comment, leave a like, share with your friends and your family. Until next time, Happy New Year and have a blessed New Year. I'll see you guys in my next video. Bye.